Good evening, and thank you for joining us for tonight's program, From Resistance to Resilience. This is the third in a three-part series on mental health in our community. Tonight, we examine sending our children to school in the time of COVID-19. I want to thank each of you for being here for this important conversation. At American Public Square, we're committed to our mission of improving the tone and quality of public discourse by helping our community meaningfully address society's most perplexing issues. And this one certainly qualifies as one. We rely on the support of our members to do this. And to those of you that are already APS members, we want to thank you. To those who are not yet members, I hope you'll consider joining today. You can learn more about our membership at our website, americanpublicsquare.org. We have partnered with Kansas City Public Library on fact-checking for our program tonight. Jenny Starr is a health and wellness specialist on the community reference team. She's the author of the fact sheet for tonight's program, which you can find on our website. Additionally, Jenny will serve as the fact checker for tonight's program. Special appreciation goes to our presenting sponsors, which are the City of Kansas City, Missouri, the Hall Family Foundation, the H&R Block Foundation, Sue Seidler and Louis Nerman, PlexPod, and William Jewell College. And this particular program is generously supported by the Health Forward Foundation and KC Common Good. Denisha Snell, the APS program manager, will serve as your roving reporter for tonight's program. As always, during American Public Square programming, we welcome questions from the audience. Our roving reporter will be watching for any questions you may have for our panel. Please feel free to type those into the Q&A section of Zoom. To request a fact check, please use the Q&A feature and specify that it is a fact check. If you're watching on Facebook, you may also ask your question or make a fact check by posting in the comments section. It is now my privilege to introduce tonight's panel moderator, Andrea Tudhope, coordinating producer for America Amplified, a national public media community engagement initiative. Andrea?
Thank you, Alan, and good evening, everyone. I appreciate you all joining us tonight. As your moderator, my intent is to engage in a balanced dialogue with our panelists. So with that, let's go ahead and welcome tonight's panel. Tufanza Bird-Primos has a master's in social work from UMKC and currently works as a school social worker. As a parent of 3 teenage daughters, this topic is one that is close to home. Max Eden is a senior fellow at the Manhattan Institute. Max's research interests include early education, school choice, and federal education policy. Just in time, Dr. Letitia Woodley was an alternative education student, now district administrator, who specializes in working with turnaround school transformation initiatives. Dr. Woodley now serves as the executive director of student support services for Kansas City, Missouri Public Schools. And Mark Logan is the founder of Idealect, a social innovation consultancy based in Kansas City. Idealect uses a human-centered design framework to help clients achieve greater social impact through innovation. Mark is representing Comeback KC, a private-public collaboration to create a unified strategy and message to help the entire Kansas City region make a comeback from COVID-19. Their full bios can be found on the American Public Square website, along with tonight's fact sheet and mental health resource information. Before we get started, I want to make a point to say that if you or someone you know is suicidal or in emotional distress, please contact the National Suicide Prevention Lifeline. That number is 1-800-273-8255. Again, 1-800-273-8255. Trained crisis workers are available to talk 24 hours a day, 7 days a week. All right, let's jump in. Obviously, these have been unprecedented times for our young ones, to say the least. I know we've got a few parents on our panel tonight, but I'd love to start with Tufanza. As I mentioned in your intro, you have children at home. We'll get more into the ins and outs of remote education later on in the conversation, but sticking to mental health for now, speaking as a mother, how are your children doing during this extended isolation? And what have you observed about how they're coping?
I think my children are doing relatively well. I can only speak for my own children. We have put in place specific protective factors for them. And so they're doing fairly well. they also have each other at home. So they've been able to keep their best friend at home. I, however, think that there are a lot of children who are struggling because they are isolated from friends. They don't necessarily have the same supports at home that some children have. I specifically am worried about children who have experienced abuse or neglect. I've spent some time in the child welfare space, and there are some challenges there for children because there are no extra eyes on those children.
I wanted to ask what you meant. You said protective factors. I'm just curious if you can tell us more what that means.
So some protective factors are support systems. So my children are still connected with our faith community. So they have weekly calls with our pastor. They also still talk to our extended family. Other protective factors could be,
Sounds like community connectors is what you're talking about.
Thank you.
Yeah, which is hard in this time. I do want to get more into the sort of disparities. You said that you guys are lucky to have your kids are lucky to have each other and have a good support system. But I also wanted to quickly ask, not just what are your concerns for your kids during this isolation, but also what are some of the ways that you've seen them thrive? I mean, the title of our program here also has the word resilience in it. So I think we should acknowledge that as well.
So I think my oldest, who is off at college now, I have seen her blossom. And some of this has been because she's had to learn to make friends in a different way. So she's connected with people from her college before she got there. So she talked to them via GroupMe, via the telephone, Zooms, etc. So she has really learned to connect with people in a different way. And she was typically a shy child. So I did worry about her, but seeing her in the past, I mean, she's been at school for 5 days, so I don't know how it's going to turn out long term, but she has been able to reach out to people, which is something new for her. And I actually think that it being on social media or through other digital platforms has been easier for her than having to go up to somebody and say, hi, I'm a brand new person. So there are some kids that I think will thrive with that safety net of a virtual connection versus having to really put themselves out there face to face.
So, Dr. Woodley, I'd love to turn to you. Mental health care for our students is not always readily available, depending on the school, depending on the location, and we know there are equity issues at play in that regard. And now to strive to provide mental health support for these children remotely, and some of that gets to what Tufanza was talking about with like home environments that might not be safe, where there might be trauma. I imagine that's even more challenging. So as a school administrator, I'd love for you to speak to this and talk to us about what ways your district has engaged educators to address the mental and emotional needs of students, both virtually and in person.
First of all, thank you so much for giving me this opportunity to be on your show this evening. Of course, we know a lot of our babies are faced with some challenges that need, I say, extra love. I feel like I have the best job in the world. I get to wake up every day and I get to make a difference in the lives of kids. And so in my role as Executive Director for Student Support Services, I have been able to kind of really look at what are the disparities disparities are in our community and come up with ways to try to address those needs. And so one of the first things I did coming into this new role is to identify that we were not being able to meet the vast needs of our students and reach out and seek out funding to try to expand the number of staff members that we had in order for us to kind of make this happen. So in Kansas City Public Schools, we went from 8 clinicians a couple years ago to now have 8 clinicians supporting 35 buildings to now having 18 clinicians supporting 35 buildings. So we're able to more than double the number of clinicians to be able to support the needs of students in our district. So we're excited about the ability to expand our repertoire of services to meet the needs of kids, and then then come along COVID into this mix. And so then we had to do a quick shift and come up with a new normal of how do we now change the way our modality of service in order for us to meet the needs of kids. And so we had to really try to be innovative in our approaches and trying to make it happen. So one of the first things we began to reach out to our students, and we reached, we pulled, all of our contact information for every child that we had in the district. And we began to, with our school counselors and our trauma sensitive clinicians, reach out to every family to make sure we made a connect. How are you doing? What are your needs? And things of that nature. And so then we began to identify students that we were not able to reach out to. One of our main priorities were the students that were already on our caseload, students that we already knew that was experiencing some trauma, and trying to make sure that we're able to kind of keep in contact with them. But one of the main things, of course, is when you are in a distant situation, you're not able to look into the eyes of a child and see their needs and see, something they may not be able to say to you, but you can look at them and say, okay, something is not going on right with this child. That you're able to kind of see from their facial expressions and their mannerisms that they're maybe struggling in some regard. So we began to shift to a telehealth delivery model where we're able to engage virtually with our students and our families. We did an all-out I call it a campaign to tell our families in the Kansas City community, our buildings are closed, but we're still here open for service. We did no contact wellness checks where our security officers went out to the homes or the last addresses of the students that we were unable to reach via, email or phone or other methods. And we were able to really contact about 90% of our families and try to make sure, what their needs were, provided them, make sure that if they needed food, if they needed resources, if they needed, mental health support. So we're able to, like I said, reach a majority of our students in that manner. But the one thing, of course, that keeps me up at night, being in my position, supporting, 14,500 kids, even if we're not able to reach 100% of the kids, there's still some child that may be out there that needs support that we don't know about. And so that keeps me up at night. But we have, we continue to be innovative. I said, we have to embrace this new normal and find different ways to engage with our families and let them know that we're here support. So we have a hotline number for every school. And so, every school has a clinician that's dedicated to that particular school that can provide support for our families. We reached out to the neighborhood associations, provided them with the information, all youth servicing organizations that provide them with our hotline numbers to let them know that we're here to serve them. So I'm excited about the work that my clinicians were able to do during this pandemic, but of course we know there's still more work that needs to be done.
I'm really struck by what you said about the barrier of not being able to look into the children's eyes when you're trying to provide this outreach and really get to know what they're experiencing. That seems like a real challenge in this more virtual distance moment, especially with accessibility issues in terms of virtual connections. To slightly pivot, I'd like to talk a little bit about, we'll get into this a bit more later as well, but from your perspective, Max Eden, thinking about a physical return to school buildings for our children, how does the mental health of students factor into your recommendations?
Yeah, I think I'd like to bridge the topics, right? Because there's a point that Jufonso raised that I want to give further emphasis to, which is that, for a lot of students, their teachers, their school, that's the required report. That's the biggest point of contact between them and the public sector or the public system. If there's something wrong in the kid's life, it's very, very frequently the teacher who will know, the teacher who will tell an authority. And one of the things that we saw, kind of a news story cycle that appeared early on and seems to have fallen by the wayside of the debate is, over and above the mental health questions, but children getting abused and killed at home. There was one story I recall in May, the Dallas General Hospital saw 3 child abuse deaths in a single month. They typically see 6 in a year, and you see that and you just wonder, oh my gosh, right? Because when you don't have the requirement to be there in person, and also as Dr. Woodley said, when you don't have the ability to look people in the eyes, you run the risk of missing this, right? So I think that we, unfortunately, when we think about the physical health side of this, we might be overweighting to the dangers of COVID for the kids and underweighting the dangers of kids continuing to fly under the radar. So how this factors into school openings, I think it argues very, very strongly for some required in-person components, even if it's only once a week, right? Because I can't speak with specificity to what Dr. Woodley is saying, but other big districts like LA and Chicago, you see the reports that tens of thousands of students have gone missing. They can't get in contact with them. And you don't really, Dr. Woodley, Tufanza, somebody in their position wouldn't know what that means. What does it mean that we can't talk to this kid? And if we don't know what it means, we don't know how to prioritize. But if there were a physical requirement and like, oh, wow, well, yeah, Johnny and Susie and Shirley, none of them have answered the emails, but only Johnny's not here. We need to figure out what's going on with Johnny. That's a way that social services can connect with kids. And I think that's probably the only way that social services can connect with kids in a way that gives them enough information to act. So that might be, the biggest thing, the biggest consideration of mental health when it comes to schools, when it comes to how do we make sure kids are okay and treat them well. That's frankly more Dr. Woodley's department than mine. But in terms of what action should we take based on it, I think it argues very, very strongly, not necessarily 5 days a week, but some in-person requirement to give the people taking care of our kids that knowledge.
So because of the spike in COVID-19 cases in our area, the Jackson County Health Department has recommended districts push back the start of the school year to September 8th, which health officials believe could prevent several districts from opening face-to-face as many had planned. And Mark, Logan, I'd love to turn to you on this. I'm curious from your vantage point, what do you think this delay could accomplish?
It could accomplish me unmuting myself. Well, first off, I want to acknowledge that this whole discussion, this whole complex tangle of data is fraught with difficulties and difficult choices on all sides. For many people in Kansas City, there really are no good choices. There are just varying degrees of bad choices. And so I think we ought to give ourselves and everybody involved in these decisions a whole lot of grace and space. I also just want to applaud Dr. Woodley. I think the innovation and nimbleness that she has demonstrated is really exemplary and is what we all need to embrace, this sort of spirit of, okay, things have changed, let's adapt and move forward. The delay could accomplish or could allow us to get the virus under control. To Max's earlier point, if the decision were simply about the safety factors related to the virus, there's no question that we would not open school right now. Just can't do it. Right now, I think we're at around 350 or so cases a day in the metro area. That equates to 16 or so cases, new cases per day per 100,000 population, which the Harvard Pandemic Center says rates as a level orange alert, meaning stay-at-home orders should be implemented. So we're in a situation in the metro area where really everyone should be staying at home. So that's the environment we're talking about. If we could get everybody in the metro area really pulling together with a sense of commonality and common good, and doing those simple things that we all know need to be done, wearing a mask, staying 6 feet apart, not gathering, then this delay would allow us to get the community spread under control. That's the potential.
To pivot back a bit to, we've been talking about mental health and physical health for the kids, and these are both complicated areas and actually can be very related as well. Mark, again, I wanted to ask you, what does the data tell us about the mental health of our community members during this time, and how, not just our kids, but how the mental health of the rest of the community is affecting our children in turn?
Yeah, so I don't have any data specific to the Kansas City region, but we do know that the data across the country shows increasing levels of stress, opioid use, alcohol abuse, suicide. So the mental health toll is very, very real, and it's a factor that has to be weighed in. Which again is one of the reasons why I love so much some of the things that Dr. Woodley talked about. They've embraced the need for physical health safety, as well as reaching out and finding new ways to connect with kids to address the mental health. But it's absolutely a very real factor. I think almost anybody in the country right now who doesn't have sort of at least a low-level case of depression is not living in reality, right? And I don't say that lightly. I think that's
Right.
just, this is a historically difficult time that we're living through, right? We have a once a century pandemic, and we have a once a century global recession. The GDP dropped 32%, right? I think if I remember correctly, that came out last week, the last quarter report. That's never happened before. So these are historically difficult times. And again, I think we need to extend ourselves a little bit of grace to deal with it.
Dr. Woodley, from all of the good virtual outreach with the kids in your district that you've been doing, what have you been learning about the mental health struggles or successes that they've been experiencing during this time?
But of course, what you have is, you have a tale that of the have and the have nots. You have some kids are thriving. Some kids tend to, find their niche and their circle of being able to connect socially with their friends and still be able to kind of have some sense of connection and some sense of community. Right now, our major concern is that what we're seeing is right now with the conversations about us not being able to come back to school and things of that nature, we're seeing some sense of learned helplessness. And saying, okay, so if some of our students that like were on the verge of dropping out or having some families with financial issues are choosing to say, well, hey, maybe I won't go back to school. Maybe I need to work and kind of help my family, because say some family member has lost their job and things of that nature. So especially one of the major areas we're seeing this shift is in the Northeast community. Some of our Hispanic families, our Hispanic outreach coordinator, has shared the struggle of saying, hey, yes, we understand that you may be going to work, but we do have options where you still can attend school through our virtual academy. And our virtual academy allows flexibility. So you don't have to be logged in at a certain time to meet with a certain teacher. You have flexibility. You can, do your work at night, or do you work on the weekends? And there's some flexibility so you can still, meet the financial obligation that you're trying to help out your family with. So the struggles are plentiful, when you're dealing with, the financial woes of the community. And right now, of course, we're dealing with a high level of evictions in our area. So, families, right now that the moratorium on evictions are coming up, that families, having that stress of not, being, not knowing where they're, going to lay their heads and things of that nature. And so you're seeing a, high level of depression or anxiety as those shifts take place. So there are, just multiple different areas. And then deaths. I mean, in our school community, me, myself, individually, I actually just lost my aunt on Friday. I've lost three individuals during this pandemic. I've had several family members that have been diagnosed with COVID and struggled, and they, some have survived, but 2 family members that died based on, due to COVID. So, dealing with that whole idea of family members, even, in my own department, having family members, employees that are having to care for family members that are ill, family members that are passing away, and things of that nature. So we're seeing all throughout. So some of the other things that we did in our school district, and something that we're going to continue to do, is we provided a circle of support program for our staff members to say, hey, we want to come together. We want to be able, you have a safe place to come and talk about how you feel about what's going on. We did mental health Mondays. We did wellness Wednesdays. We did different, stress management. We did yoga, all these different things. We offer these free opportunities for our staff members to be able to deal with their own stress, anxiety, and of course, partnering with our EAP program to offer free counseling sessions for all of our employees and their families. So, so not only are we addressing the needs of the students and the families within the community, but our own, KCPS family, as well, as we have been hit hard through this pandemic as a staff.
Tufanza, I want to turn to you to ask a bit more about your role as a school social worker and how that's shifted, and also what you've been seeing from your work.
So my role as a school social worker is brand new to me. So I am just entering the world of school social work. So I don't know exactly what will be different this year. However, based on what I'm hearing, one, our school has more staff like KCPS in that space of social work. I'm also hoping that there will be some opportunity to go to see students, not inside their home, but outside of their home. I know that that's what's happening within our child welfare system in Missouri right now, is that visits are happening outside. So I'm hoping to be able to do that. Since I won't be able to see students in the building until we reach that level of where students can come in. Also communicating with families in different methods. So traditionally, there may have been, emails, and but now we'll need to look at some other ways that we communicate with families so that they know that we're there and providing some connections. In addition, fostering some partnerships. I know that recently KCPS has started a partnership with some of the community centers. And I think that's really exciting to hear about how they are going to provide some opportunities for students that may have not been able to be in those selective pods to still get tutoring and support and connections with other students, as well as providing before and after school care for physical well-being.
Yeah, that raises the issue that also with students losing all of their regular outlets, like their ability to gather with friends, engage in their extracurricular activities, their clubs, their sports. That also, I'm sure, plays into their ability to cope during this time.
It does. For my own children, I have given them the task of come up with a plan, and we'll work on it together. But I've told them, figure out, 1 to 3 friends that they can get together with in a socially distant way. Figure out some activities that they might be able to do while remaining 6 feet apart, and figure out how many days a week they need that. So I have teenagers. They are able to be empowered to do some of that on their own, but I would encourage parents to also come up with those plans. And so some of the things that my kids have been doing is riding bikes with friends. They've also gone out and done picnics in the park. So where each kid has their own blanket and they bring their own food, and they're still able to gather together and have food together. I think there's something special that happens when you break bread with another person, and you're able to connect in that way. I think I've also seen, so I have a nephew, a great nephew who's in kindergarten, and I've seen him struggle with, what does 6 feet look like? What does it feel like? He's ran up to friends and he's looking back at his mother and trying to figure out, okay, is this 6 feet? Can I go up and touch him? Can I hug him? And I think there's going to be some challenges for parents when they do have those get-togethers on how does it actually happen, especially with little ones, but even with older ones. They just don't know what's okay, what's not okay. Can I take my mask off while I eat? And I think that those are a lot of conversations that parents, one, they need to have the tools to be able to educate their children, but then also they need to have those conversations then with their kids while they are educated with the correct tools.
All right, I would like to take a moment to check in with our roving reporter, Denisha Snell. She's been collecting questions from the audience. I'd love to hear a few of those.
Great. Here's our first one. Is part of the reach out to students in the Kansas City region also extended specifically to their parents and caregivers? If so, what approaches are being taken with the parents or caregivers that can positively impact the kids?
Okay. Dr. Woodley, do you want to take that one?
Yes. So like I stated earlier, we have on our website, if there's any parent that attends any of the schools in our Kansas City district, all of our 35 buildings, there's a hotline number so that any parent is in need of support, whether that is mental health support, whether that is food, if they're having issues, with housing, any type of support that's needed during this pandemic, we're here to serve them. And so if they can, reach out to those hotline numbers, it goes directly to a clinician, and we're able to assess the situation and provide them with the resources that we have available to support them.
I did want to get back to Fonzie. You were just hinting at some of the extra challenges for early education. And Max, I know early education is one of your research interests, and I was wondering if you wanted to talk a little bit more about that.
Most of my research interest is the policy level, less in the, what do you do with kids and how do you keep them properly apart? So I fear I can't speak to a great extent on that, except to say that, frankly, you probably can't. And that's part of what makes this exceptionally difficult. Part of the discomfort of all of this is that the things that kids need to do, that people need to do, they require a certain maturity to accept without the risk of kind of inducing neuroses, right? Tufanza, you and I could get together, stay 6 feet apart, it wouldn't kind of affect our psyche. But telling your 3 and 4-year-olds, don't get too close, gets dangerously close to scripting for your kids the characteristics of a mental illness. So I don't really have a solution for that. It's just kind of an added layer of ugliness onto all of that in their early education space. And I don't envy people who are trying to figure out ways to get the kids to behave in these ways without, potentially giving mental side effects as part of the attempt to prevent the diseases.
I want to say quickly that there are some approaches that we can borrow from other countries. I saw an incredibly darling picture, I believe, of some young school students in South Korea, where all of the kids had on a pair of 3-foot wide wings. And so that's how they were teaching the kids to stay 6 feet apart. If your wings are touching, you're too close, right? And so you normalize it, you make a game out of it. I don't think it has to result in lifelong psychological damage. But again, it takes that spirit of nimbleness and innovation to help figure out how do we navigate this new normal in a way that feels healthy and in a way that isn't scarring.
I'd love to take one more question from the audience. Denisha, I believe you have another one for us.
Yes, I do. In the midst of these outreach efforts, what does this look like from the state level in collaboration with local school districts?
Okay. I feel like I keep coming back to you, Dr. Woodley, but do you want to take that one?
What I can say is, I guess, I think as Mark said, trying to give people grace in this space because this is a new experience for everyone. So there are no experts in this experience because we've never experienced this before. And so normally we look to the state, we look to the federal government to kind of provide us with guidance on how to go about doing things. And what we found is, for the most part, it has been really and truly not a lot of guidance. And then basically having to, look at your situation. And I always say, checking the heartbeat of the situation and then diagnosing what you can do to mitigate the situation and then apply a prescription to meet the needs, as they come. And so that's what we've really been faced with. And so the state and of course the federal government were slow to kind of provide guidance because, there was no experts already laid out to say, hey, when you're faced with a pandemic, these are the things you should do. So, sometimes it was at a place where it was frustrating trying to say, okay, so what should we do in this regard? Are there any parameters? But I think, like I said, we tried not to really take a negative approach to not getting information, but just basically saying, how can we do the best that we can to love on kids? And, basically I'll look at it and I believe in my staff. I believe in failing forward. I believe in trying something to try to meet the needs of kids. If it's not working, let's try something else. And we keep trying until we come up with the best solution to fit the situation. And that's what we did in this regard.
So on that note, I wanted to dig into a little bit more to remote learning and ask how your district handled distance learning in the spring and how that's impacted the current plans for this school year.
Well, we had a lot of lessons learned from this experience. So literally, we went to school on Thursday and I believe it was, so we had a meeting on Thursday. Friday, it was a Friday before spring break. So literally, we thought we were going to be out one day and then maybe spring break, and then we can kind of come up with the plan to go from there. And then we ended up 6 months later, still not back in school. So needless to say, we had to pivot very quickly on our approach to try to meet the needs of kids. And so what we learned from the experience was that number one, of course, about the digital divide and the lack of accessibility, the disparities that the have and the have-nots of our babies being able to access the resources. So, so we began to get into full crisis mode of getting laptops, to try to, ease that divide, get hotspots out to our families and things of that nature. So we were busy, providing the infrastructure. And so some of the details we didn't cross all the I's and dot all the T's. And so one of the major lessons that we learned is making sure that we bring parents along through this process and make sure parents are fully aware and understand, the platforms that we're using. Make sure that parents know how can they best support their children, looking at, what are how long should teachers engage with students to make sure we're not teacher burnout and student burnout. How do we best make sure that we are identifying and addressing academic deficits as well as trying to remediate and accelerate students at the same time. So I'm so excited. We have some great and innovative things coming out for the beginning of the school year. Our digital learning team have been working really hard. Our FACE team, we call it our FACE team, which is our family community engagement team. They have Parent University rolling out to make sure parents are trained on how to best support their children and resources for them to be able to learn how to best support their kids. And of course, then we're offering flexibility personally, how do you want your kids to learn? Is your child kind of self motivated and can learn from the KCPS virtual academy, where they can work at their own pace and kind of learn at their own pace and have flexible time? Or do they need a more directed approach where they're able to, learn remotely, but they have a teacher that they log in, they engage with a teacher who actually teaches the lesson, and, provide them with that direct support. Then of course, we learned that immediately being able to assess what students are logging in, what students are not, and how to get our counselors and our clinicians involved and reaching out to find out what's going on with the kids so they're not being left behind. So just like I said, a lot of lessons learned. We dug in and really did this summer and just really looked at feedback. We surveyed our parents, our students. We had conversations, with everyone involved, our teachers. How was this experience for you? How can we make it better? And we're excited, and we believe that the work that we're able to do this week, we're doing Teacher Institute, where teachers are being trained on different modalities on how to best engage with students. We did training with our new teachers coming in on social and emotional learning, how to identify virtually if you think that a child may be experiencing some social and emotional issues. What are some ways to kind of engage and be able to kind of, reach out to families. So we're doing a lot of great things different this year. And I think that our parents are going to be well pleased that we have listened, learned, and we're implementing a new way of doing school, a new normal.
Mark, what can your research tell us about how schools in the Kansas City area have fared versus schools in other states when it comes to distance learning and some of the adaptations that we've been, that the districts have been carrying out?
So I don't have data specifically on that question, but I do think that the approach that Dr. Woodley just described, I think, is playing out across the country. The spring jump with 0 days notice to virtual learning really caught everybody off guard, and school districts by and large were not prepared for that. And I don't want to be Pollyanna about anything to do with this pandemic, but I think there are a couple of silver linings that are starting to be revealed. One of them, Dr. Woodley mentioned already, in terms of telehealth, right? And that's playing out broadly, systemically in all sorts of domains, not only education, also things like substance use disorder treatment. We are now better equipped to deliver quality telehealth. And I'm firmly convinced that we're better equipped now to deliver a quality virtual educational experience than we were in the spring. And that's important because just, being completely candid, I think the experience of the Georgia high school last week is very instructive. They opened up week 1, kids are walking around the hallways, no masks. Week 2, they've shifted to virtual learning, right? Because they've got over 800 quarantined kids, teachers, and parents. So, I am not an epidemiologist, but my educated guess is that every school that opens up in person, at least if they were to do it in our current environment, would be closed within a week, right? Would be shifted to virtual learning. Because here in the Kansas City metro area, there's just no way. Georgia Tech has a website that allows you to estimate the probability that someone in a certain size gathering has COVID based on the community spread rate in your area. In the metro area, there is no county, no school district where you put 1,000 kids together, which is the size, I believe, of an average elementary school, at least in Kansas. In every single county in the metro, the probability that at least one person in that group is going to have COVID is greater than 99% right now, based on our current rate of spread. So it's kind of impossible to imagine a school opening that isn't going to result in cases of COVID within a week, given our current rate of spread. Now, if we truly all pull together and we do the things as a society and we take individual responsibility, then we can get to a point where the community spread is much lower, And it is safe from a COVID perspective to reopen schools, but we're just not there yet.
Max, I'd love to give you an opportunity to chime in and respond to some of what Mark said, but specifically I'm thinking, he said he believes that we're more equipped now to provide a virtual learning experience than we were early on. And I hope that's true.
Yeah,
after all this time, but yeah.
I hope that's true, but it's also a very, very low bar, right? I mean, unfortunately, one of my colleagues at another think tank, the American Enterprise Institute, they tried to do a randomly selected sample of school districts to figure out what are they doing, how are they adapting to COVID, and do a kind of longitudinal survey week by week, starting with when it hit through the end of the school year. And my recollection, hopefully won't get a fact check timer on this, but my pretty strong recollection is that by the end of May, which is effectively the end of the school year for many districts, only a third of school district websites even referenced offering live synchronous instruction. And that's not to say that they were delivering it, and that's not to say that they were delivering it well. That's just to say that something on their school district website said at some point your student will be on with a teacher like we're on talking amongst ourselves right now. And I think we can do better than that this fall, but I feel as though a lot of the energy, certainly in the national conversations, and I imagine playing out in many districts, are more around, oh my gosh, what are we gonna do to keep things clean? How do we keep our teachers comfortable? What do we do to reassure parents? I think that there might be a false sense of, or an inflated sense rather, of, all right, well, schools have had 3 more months to figure this out. Now they've really got it down. These schools were doing a whole lot of other things during these 3 months. And I fear that we won't see a dramatic improvement from what we ended the school year with. And then once these things hit, right, as Mark said, and you saw the school district in Georgia, you can reasonably expect a handful of other schools in any given metro area will get hit, will close down for a while. Parents are going to become extraordinarily nervous to send their kids back to school. And it's not going to be, there might be a fool me once, shame on me, fool me twice, shame on you. Not that there's any shame to be directed to the school district, but oh my gosh, I thought it was safe. I sent my kid back. Now it's not safe. Am I really going to send my kid back again? And in some ways, it's an exciting time for how could education evolve, but it's going to also involve, I think, a lot more dislocation than people are prepared to quite get.
Yeah, and I'll just quickly add on to that. I agree with most of what Max has said there. And I do think a lot of time has been spent on how can we keep facilities clean? How can we get PPE? And I have to say, I think a lot of that was wishful thinking, right? That, the virus will have gone away or will be under control to a point where it's reasonable, and that just hasn't borne out. So yeah, I think we're mostly in alignment on that.
I'd like to turn to Denisha Snell, our reporter, roving reporter again. I think we have one question for Max.
We have several questions coming in now, actually. So this one is for Max. Should the federal and/or state governments be more involved in funding and logistical aid for local school districts?
Well, you would like to think so, right? You would like for the answer to that question to be yes. And as Dr. Woodley said, you would like to have a situation where somebody like her was constantly getting very good, valid, reliable information from on high, and they just felt, okay, well, we have a playbook, let's do it. I tend to be more skeptical that that's a workable theory of action because the authorities, the chances of something being said from a higher level that won't quite fit with a local school district are very high. The chances of that causing even more confusion and possibly more harm than help are very high. There's, on the one hand, a kind of a sense of, okay, well, the experts will defer to the experts will know, and they'll know something, but a lot of times in large bureaucratic structures, words from on high that maybe should be helpful and could be helpful often end up causing more confusion. So I think you'll be seeing something more, but I'm not sure it's going to be particularly helpful for Dr. Woodley and Tufans and their colleagues.
Dr. Woodley, do you want to respond to that?
Well, of course, we have definitely, of course, been reaching out to the higher ups in different areas, trying to see how we can come together. We've worked on national committees, with districts around the country, basically trying to find the next and the best practices, as well as reaching out state level, trying to really make sure that we're doing our very best. And we went so far, we had over 300 staff members working on our reentry planning. So we had staff members, working not focused, we had a group working on safety and security and PPE and that piece and, in that regard. But we had, teachers coming together about what education, how do we reframe what education looks like? And we looked at all the different scenarios. What does it look like for us to be, in a distance learning format? What does it look like for us to be in a hybrid format? What does it look like for us to be totally in person? What educational shifts we needed to make? We looked at curricular shifts. And so like I said, I feel really good. Do we have all the answers? Do we have everything figured out? No, we don't know. We don't know. But what I can say is we engage teachers, we engage administrators, we engage parents, we engage students, and we, to really and truly come up with innovative approaches of how do we best meet the needs of our students moving forward through this pandemic. And I think we're better prepared for it. We listened and we learned a lot through this crisis. And I think that we have some things in place now that our kids are going to be well served in our ability to be able to support them. Of course, we know in person is the best model because we're able to really assess what they're going on. We're able to make sure that, they're able to get the meals that they need to have done. We're able to, do better assessments, of their level of understanding and things of that nature. But we have put things in place where we're able to remediate learning. Our special ed department, has been essential. Our ESOL department in planning on how do we provide high level instruction for our most at-risk students. And so we're going into this school year, being positive that, we're going to be really trying to, put those things in place that we learned based on collaborating with, the next and the best practices from across the country.
We've touched on inequities throughout our conversation so far, but I'm just thinking about for parents in our districts who, where the plan right now is to stick to remote learning, childcare is a big problem. And I'm thinking of parents who still have to go to work, sometimes work multiple jobs, looking at supporting their kids at home. It sounds really hard. And I wonder, to Fonza, I wonder if you could give us some insight here. What do families need from the community at this time, not just from the districts or the teachers per se, but from the community?
Well, I think we need, families need support. So I think some of that looks like those partnerships. So, while KCPS may be able to hire, I think the number was 18 social workers, maybe there's a partner out in the community that can help provide some additional support in the area of mental health. Also maybe partnering. I know that the school districts and the child welfare system are typically really great partners around child abuse. Maybe providing some additional resources to keep eyes on kids, since teachers are not going to be the ones that are in the homes. I think that that's a big step. I've also seen some innovative solutions from employers, where some employers are providing a place for students to come with their parents to work, and then providing a space for those students to be able to learn and get childcare during the day. I think that it takes less of that perspective of I'm just looking out for me, and more of that perspective of looking out for the entire community. Because if you have one or two students who come into a building, we've seen in Georgia, who might have COVID, then they expose everyone else. So we have to think about the fact that we're all affecting each other right now. So that can either be in a positive way or in a way that there is some more opportunity for us to grow.
I wish there was a like button. I would be liking that so hard.
I think you can react here on Zoom, but yes. I also think there's something here to talk about in terms of the different realities kids and parents are experiencing in private versus public school districts, which is something that we haven't touched on yet. You know, the idea of we're seeing the potential reopening happening more in private schools, and I think there's obviously like resources required to pull that off in the way that will work or potentially work, and then the room for innovative ideas to make that happen. I wonder if any of you would like to talk about that separation, those two different realities.
I could say a word or two about it. I mean, I think I've seen studies and I've seen surveys that have suggested that private schools have adapted kind of more nimbly, been more responsive, at a higher rate of students saying, I spoke with my teacher every day. One survey, I think, said something, like 20% of public school children said they checked with their teacher every day versus 70% of private school children. That might not be precisely right, and it was a survey commissioned by a private school association, so you never quite know. But I think it shouldn't be forgotten as we think about it that these private schools have to open in a way that the traditional public school doesn't quite have to open, right? If the public school doesn't open, maybe some kids drop out, lose some per pupil funding. Dr. Woodley Tufanza, you lose some colleagues because that money goes. A private school doesn't open, the parents aren't going to pay for it for the year. Private school loses 1 year, half, a third, all of its students, it's going to cease to exist. So I think there's kind of one narrative out there that I've seen in some news, like, oh, this is a story of advantage versus disadvantage. The private schools have more funding and resources. And it's kind of misrepresentative. Some do, right? Some private schools are $30,000 a kid. Some private schools are $8,000. And the ones that are actually operating on less per pupil than public schools are the ones that literally cannot afford to not reopen and keep existing.
All right, we have a lot of questions coming in. So Denisha, do you want to share some of those with us?
Yes, I do. Here's another question about schools in the Casey area, but Max, I know that if you have information even outside of the Kansas City area, what does this look like? So there are some schools that are requiring students to have a negative COVID test result in their health file within 7 days of school starting. Are there any schools that are looking at, especially K through 12 schools, that are looking at requiring students, teachers, and staff to have a COVID test before school?
I don't have an answer to that question, but I do want to throw in just a little reality check for everybody. Our testing system here in the metro area is way over capacity and super strained. In many cases, if you go get a COVID test today, you won't get the response back for 2 weeks, right? Which is worthless. That's way too late. Now, if you're a hospital patient at a place like KU, you're going to get your results back the same day. But what I hear consistently is that most of the public health departments in the area are having a really, really hard time getting test results back in time. So implementing a system like that, particularly for every teacher and every student in every school district, cannot happen in the metro area. And in fact, I know that the public health departments and Children's Mercy have told public school districts that they do not have the capacity to do sufficient testing for all the school students in the metro area. So, one thing that I would love for people watching this to know is that as a region, the various jurisdictions, the various county and city jurisdictions have not built our testing capacity. We just don't have sufficient testing capacity to get this thing under control. And that is a critical weakness from a public health perspective.
Denisha, let's have another one.
Is it known if any district in the region has piloted their instruction plan to mitigate any other unknowns, especially around access to technology?
Dr. Woodley?
I am not familiar with most schools in the district have been doing as far as the access to technology. I know that it has been a struggle. We've been on collaboratives with the Urban League and some other organizations, and to determine how we best just try to support the students within our area and getting them the digital resources that's necessary. We believe that we're moving in the right direction, but we still have digital technology deserts where families do not have access to technology. And then, of course, I mentioned a little bit earlier with the level and number of evictions that is taking place within our area. Even if we did have students set up for technology, with all the high number of evictions and students moving and shifting, during this time, it's like we're chasing a moving target.
Let's get another question in. I think we still have some time and plenty more answers to go through, or questions to go through. Denisha, do you want to share another one with us?
Sure. With COVID-19, assumption that summer slide will be exacerbated quite a bit. Are there any measured studies planned for our region or nationwide that can inform on this particular issue?
I think this is ask Dr. Willie Knight to say. So one thing that we are looking at is really, being able to, we have resources available to assess our students, to find out where they are. And we have been able to identify, the standards, based on our standards mastery, what standards the students wasn't able to master within the last school year, and how do we reframe. I talked about having a curricular team that really rewrote our curriculum to really look at how to go about addressing those deficits and building on those in a way for students to recapture some of that distance time. But one thing that the Council for Great City Schools, when we conversed with them, really wanted to kind of make sure that we didn't go in with the mentality that our kids were going to be so far behind. So we assume that they may have lost, some time during this COVID period, but assess it case by case, but plan for building upon prior knowledge, and then building upon that new knowledge, and really layer in what we feel like the students missed and building a solid curriculum moving forward. So we're looking at a different approach and not looking at cramming things with kids, thinking they've missed so much and we've got to kind of force feed them with information. But how do we logically build in the information in a way that is digestible, and we make sure that students are getting what they need, and we're able to mitigate and get those additional get the learning curve up in order for us to meet the needs of our babies. So we're not going in it with the mindset that our babies are going to be so far behind. We're going to assess where they are and then build upon that, and really be logical about how do we build in trying to address deficits as well as accelerate students.
I can see that this is just such a great challenge because every student and family is also dealing with their own individual stresses. And you mentioned, Dr. Woodley, earlier about having your own family members, losing family members to COVID. Like, all of these circumstances kind of combine together to create a really individual needs, which our students always have. But this seems a particular time that you're constantly having to adapt to meet them where they are. I also am thinking back to earlier in the conversation when I think Max brought up that school can be like a safe environment and a place at least to be together to see these needs and meet them. I want to kind of come back to mental health a bit and talk about the challenges of meeting the kids where they are through this time. Knowing also that stigma exists around mental health. I don't know, Tufanza, do you want to chime in here?
Well, I mean, I think there's, so while telehealth has improved during this time, I think one thing that we've been able to find is that teletherapy for very young children is a struggle. So they don't understand that a person on the screen is actually engaging with them. And so I think we have a challenge in front of us to come up with new strategies or, like I said before, partnering with other agencies that are meeting face-to-face with children and families and providing that therapy. I think that's something that could then be a partnership that could grow beyond just this time of COVID. So that would help us to look at the counseling and social work resources within schools and actually grow our programs out from just staff at schools to community partners, and then break beyond some of that stigma, because if more people are receiving mental health care, then more people will be advocates for mental health care.
I do wonder how this whole experience will change our discussions of mental health. I mean, it seems that we're talking about it more openly now, just as a society, because there are kids and adults dealing with mental health struggles that maybe some have never had before, or that they've never had to address. I wonder, what do you think will change in education related to that? I mean, it does seem that mental health has become this more focal point of just the whole process of meeting kids where they are and factoring that into their education.
Well, one thing that I've been trying to do during this time is express that COVID is trauma. So if we normalize trauma and express that we've all experienced trauma, then I think that it normalizes us all getting mental health care. And then it also allows us to see that trauma does impact our school system. So if we look at, everyone has been affected by this trauma of COVID. That affects a student's education, their ability to focus, their ability to be able to be present in school. Then we can look at solutions within our education system that show that address the trauma that our students see. And then it can be normalized as part of just what every student receives as part of their education system is a trauma or resilient based education.
I think we've got time for another question from the audience, Denisha, if you have one.
Yes, I do. What is the acceptable level of risk parents should be willing to take to send their kids back to school?
Mark, it seems like you might want to answer this one.
Yeah, boy, I do. I just want to go back to where I started, right? That this is a really, really hard, complex, difficult question. Everybody deserves some grace in this. And that for a lot of people, there are no easy answers. You know, I will say that when it comes to the physical health risk that COVID presents to children, we do know that kids are much less likely to die of COVID than adults. But I think the total nuanced picture of risk is really hard to assess, in part because for every kid who dies, there are 10 kids who are hospitalized in the ICU. We know that 97,000 kids got COVID in the last 2 weeks of July alone. So there are some myths out there, right? Kids don't get it. That's not true. Kids are basically immune to it. That's not true. There are also a whole lot of outcomes that are not death that we don't know enough yet about, but that are not good. So for example, there was a study in Miami of asymptomatic patients, and it showed that 67% of people who didn't have symptoms had signs of lung damage on chest x-rays. And that included kids. You know, we know that COVID is affecting every organ in the body. I mean, literally every single organ in the body, not just the lungs, the heart, the brain, all the way down to the testes for men. So, you know, maybe that'll get some attention. And we know that we're seeing these signs of damage in kids too. So what we really don't know is whether that damage is permanent, whether it's going to clear up in a couple of years, whether it's going to produce lifelong, you know, chronic conditions, or whether it's going to be no big deal. And I think that area of vagueness makes it really, really hard to answer the question of what is an acceptable level of risk, because we just don't know what the risks are.
Well, it also raises the concern that, I mean, the CDC just came out with a report last Friday, I think, that says Black and Hispanic children are more likely to require hospitalization for COVID-19.
Eight times more likely.
Yeah, yeah. So
you know, we touched on inequities, and you know, one of the ways to frame up this question is there are competing inequities, right? On the one hand, we have the numerous inequities that have been exposed in telelearning and the systemic gaps that are presented if we don't have in-person school. But the very same kids who are harmed by that are the ones who are more likely to be harmed by COVID-19, and whose family and communities are more at risk from COVID-19. So again, it becomes a really hard question to answer, you know, when you got bad options on one side and bad options on the other side. And which ones are worse kind of depends on your unique perspective. So again, Grace.
Tufanza, I think you wanted to weigh in.
I was just going to say, I think that risk is a very personal decision. So I think that one thing that I hope that we will do as maybe some of the risk decreases is empowering families to be able to make some informed, wise decisions for themselves and for their families. I think I expressed that I have one student who is at school and in person, and she started classes today. But she's also older, where if I had a kindergartner, I would probably likely choose to keep my kindergartner at home. So I think it's a really personal decision. I think there's also rural families that may not, a hotspot may not even work for them. So how do they provide education for their students? You know, it's just a really personal decision that goes from family to family, student to student, and also district to district.
Also, I think the choice to weigh risk factors might also be a privileged position to be in for some families. So I'm sure that weighs in as well. We're wrapping things up. I wonder, Denisha, are there any other questions from the audience before we kind of look to the future and do a rapid fire round?
I think we've had a lot of questions that have been really specific to KCPS. I would like to ask this one last question. If there are, in your work with Kansas City Public Schools, if there are families that are exhibiting that they are in a crisis mode, how is that being handled?
Like I said, if we have families that are in a crisis mode, we have clinicians assigned to every school to address those challenges. So we implore that you please reach out, go to our website. There's a link that says social and emotional resources. Pull up the link where that has a list of our hotline numbers for each building. Reach out to us and we are here to serve you. So if you are not alone, our buildings are closed, but we're still here to help. So please do not suffer in silence. Please reach out to us. We have resources that can help and that we will help. So please reach out to us.
So I'd like to pivot just for the last portion of the conversation to look to the future. As some of you might know, American Public Square, it's a tradition here to allow each panelist to have a final comment, and we do this in the form of a brief response to each of two questions. So what and now what? So let's start with Max Eden.
Yeah, so what we had a discussion about all of the unpleasantness that COVID has wreaked into community. And as Mark said, there's probably no good answer that requires grace from it all. But now it's time to see what Dr. Woodley and Tufans and all their colleagues can pull off to try to get kids back enough so at least they can be seen.
All right, Tufanza.
My so what would be, we need to empower families to be able to make good choices for their students. And now what, families need communities to wrap around them so that we can create a brighter future for all of us.
All right, Mark Logan.
I guess my so what is things are changing. This is a new virus. We're learning stuff every week. So, keep your mind open to new facts and be ready to change your opinion and position and adapt. I want to echo Tufanza's point about community. We all really need to act in community with each other, look out for each other, do the right things for each other. And I'll just end with, get your flu shot this year. It's super important. And when a vaccine becomes available, get vaccinated, because vaccines don't save lives, vaccinations do.
And since it's been the Dr. Woodley, Ask Dr. Woodley show, I thought we should end with you.
So my so what is that coming from my heart is a lot of people, I believe, still don't take this this virus seriously. And coming from a place where I've lost loved ones. And so when you lose loved ones, then you know how serious this is. And so for me, it breaks my heart to see people at resorts and, and not practicing social distances, still having these huge parties and acting as though this disease is not real. Having to sit in an ICU and watch a loved one pass away is the most painful experience that you want to experience. And having to suit up every day, knowing as you walk down the hallways, there are people right next door having COVID and they're struggling, that are dying, and being on the front lines and seeing this from that angle, then you know that we have to do something different. So I think Mr. Logan says it best. Right now, we are a high alert in Kansas City about the number of cases, and they continue to rise. We want our babies to be in person. We want to be able to love on them. We want to be able to look into their eyes. We want to make sure they have food and have the resources that they need. But we need the help of the community by us deciding that we're going to think enough of the students that we're going to be socially distant, that we're going to stay at home, and we're not going to continue to perpetuate the activities that continue to have the increasing numbers of this spread so that we can get back in the buildings. But if we continue to act as though that COVID does not exist and that is not a big deal and we don't want to wear our masks and things of that nature, and then, we're just going to continue to be on a decline, and we're going to continue to have the conversations about why school can't reopen because we're not willing to make the sacrifice for our babies in order for them to get the education they need. So what, please, let's do what the experts are saying. Let's listen to science. Let's listen to medicine and do what needs to be done. And now what we're going to just do our best to, embrace this new normal and love on our babies distantly in order for us to try to mitigate the situation that, that we're in right now.
Well, I'm sure that this is a conversation we could spend much more time on, but on that note, it is time for us to wrap up. Thank you all so much for joining us, and thank you to our panelists for such an engaging, lively discussion. With that, Denisha, I will turn it over to you.
Thank you. So thank you again to our panelists, our moderator, and our fact checker. This has been a great conversation. To those in the audience, thank you for taking time out of your evening to join us for this important discussion. We appreciate the liveliness of our audience and asking questions and helping us to expand how we think. You can watch previous programs and access our fact sheet for tonight and mental health resources via our website, americanpublicsquare.org. Tomorrow morning, we will be sending out a short post-event survey, and I ask that you please take a few moments to fill it out. Your feedback helps us as we plan events in the future, and it's greatly appreciated. Again, thank you and have a great evening. Good night.